Hi guys, Heather here. Hope everyone had a holly jolly Christmas. Well, this video request comes from Greg, a future male nurse, and he had some questions about, well, how do I put this nicely? Death? But it's not as creepy as it sounds. Well, it is kind of creepy actually, especially after they die. I always think that they're gonna come alive and grab me, like they do in the movies, but that doesn't really happen. At least to me anyway. Unless I passed out from being frightened to death and have no recollection of the event, I can't really be sure. So the first question is, how often do my patients die? Well, do you honestly think I would let my patients die? No way, not on my watch. Okay, only a couple hundred or so. That's not bad, right? Or maybe it was around 5. Or 5 of them weren't my fault? Somewhere around there. But most of them were expected deaths, except my first one, which happened totally sooner than I thought it would, and it freaked me out because it was my first death. Next question. Can you kill a patient by administering a wrong medication? I suppose it's possible, and has happened, but not by me or anyone else I've known. Unless they're not telling me something. Actually, there was this one time. Never mind. That's why it's important to give the right medication, the right dose to the right patient. At my current hospital, they have a really good medication system where we have to pull the patient's name up on the computer, scan their armband, and then scan the medication that we're about to give. And if any of those are at fault at not being right, then the computer buzzes like really loud and starts alarming so everybody knows that you messed up. Okay, it's not that intense, but it's a really good system to prevent medication errors. I think every hospital should have this system because it's easy to mess up if you're not paying attention. And if this does happen, and hopefully it won't, you'll have to write up an incident report explaining what happened, then let the doctor know, and then you're taken in the back room and beaten. That's what I hear anyways. And then you'll have to pray to God that nothing bad happens to your patient. Okay, I'm totally kidding. Last question, Heather. Have you ever killed anyone? Do I look like a killer? I try and look as innocent as possible. But to answer your question, thankfully no. That I know of anyways. And I'd like to keep it that way. It's really hard to kill someone unless you're being completely careless, neglecting a patient, or not giving them the medication that they need. I guess it's possible, but who knows? I never tried it. Well, that's it for today's chit chat on death. Shh. Everyone have a happy new year. Be safe and have fun. Bye. Next question. Can you kill a patient by administering a wrong medication?